Nigeria has no case of Ebola right now, no confirmed case, not recorded. What would you say Nigeria did differently from other countries?
That's a great question. Nigeria's response in terms of the difference from other countries had to do with the speed at which they began their response by identifying the imported case and the establishment, the utilization of the incident management system with the establishment of an emergency operations center. So the first part is identification of the imported case. That came from the healthcare center where that individual went to seek treatment. So again, it points out to us just how critical it is to obtain all of the details when you're talking with someone who has fever, nausea, diarrhea, etc. You have to find out, were they in any of the countries that have an Ebola outbreak occurring? If not, then it's not going to be Ebola. So this individual had those kinds of risk factors and then was identified, contacted the state and federal government so that human resources assets could be deployed to Lagos to then stand up the response. So that next aspect, standing up the response, was a very critical piece. So Nigeria has experience in the incident management system and emergency operations centers. Right now, Nigeria has a polio that has been occurring, and they've, for the last few years, been using an emergency operations center in order to contain polio. And it's been quite effective. The number of cases of polio in Nigeria has been steadily decreasing over the last few years since the emergency operations center system went into place. So that, I think, was a very critical aspect in this response for Ebola. They have the expertise already, and that expertise was on the ground to immediately begin all of the operations components that are necessary for the Ebola response. Those things that we've already talked about, such as the epidemiology and surveillance piece, the case management piece, which includes not only the treatment aspect, but the decontamination aspect as well. The points of entry piece, which is where we identify, put into place screening measures for people who are coming into the country as well as people who are going out of the country. That I think was a very critical difference in Nigeria's response. Another aspect that Nigeria has is the laboratory capacity. Nigeria already had a laboratory here that was accredited by WHO to be able to do the Ebola testing. So they merely had to make sure that they had the diagnostic materials to be able to do those tests rapidly. Nigeria does need to remain alert, just as other countries need to remain alert. We know that this is an interconnected world. People travel every day between countries. And so Nigeria, based on its presence, its size here in West Africa, the fact that it has an economic and industrial hub, there are people who come and go regularly for work activities. So it's very important that we continue with the point of entry activities, as we call them, or port health. Port health here has begun those screening processes several weeks ago in response to this Ebola outbreak. And those are some of the aspects of the Emergency Operations Center that really need to continue for months and months into the future.
And what about education, continued education on public health issues?
Education is a critical piece of the outbreak response. The Emergency Operations Center here has had a very robust communications and social mobilization team. The social mobilization team, between those communities that were affected here in Lagos as well as in Port Harcourt, are visiting on average about 1,500 households every day. In addition to that, they're also doing road shows. They've worked on jingles that go on radio, television. They've met with Nollywood actors and actresses to get all aspects of communications involved in getting messages out. We also have a very robust social media aspect with a Twitter account, a website, and the helpline that I mentioned earlier that are all part of the response effort.
Okay, I know that some of the partners from the World Health Organization, the CDC, you guys are not going to stay here forever. So would you say that the capacity that Nigeria has built right now will be able to stand on our own to be able to take care of just in case something else pops up or even Ebola?
Nigeria has, as I've mentioned, has emergency operations centers that have been set up already in some of the other states for the polio epidemic. Now we also have emergency operations centers in Port Harcourt as well as in Lagos. The next steps in terms of preparedness really go towards training and working with all of the states in the country on identifying what are their preparedness plans that they've already begun to develop, helping them to integrate those plans into an incident management system to identify what their own assets are that they could call upon if they need to stand up their own emergency operations centers. Those assets might be personnel. They would also be the resources, financial resources that would need to be mobilized, commodities, as well as specific facilities that could be used to house, like this, an emergency operations center itself, and the treatment unit, should that be needed. So we do have trainings that will be taking place. The Minister of Health already made funds available to begin those trainings. We've been putting together from the training team here a training plan on scaling out the national training across the states.
Okay, and finally now, what lessons do you think we should learn from this outbreak, whether in Africa, whether in any part of the world?
The lessons to be learned from this outbreak, I think, are many. First of all, we know that early detection is key. Having surveillance systems to be able to identify when there's a change in your community. That change could be that maybe the emergency room is suddenly seeing more people coming in with specific symptoms. That change could be that a community health worker is beginning to hear more of the community members complaining about certain symptoms. So identification through strong surveillance systems is really critical. The response and the speed of the response is also very critical. So making sure that the emergency preparedness planning has been done, making sure that once it's done, it's not just put on a shelf. You have to practice. You have to continue bringing people together, meeting, and making adjustments based on what you think the outbreak might require. And then, of course, the detection as well. So once you start to identify changes, you have to know what it is. You have to be able to diagnose, to determine what it is, so that your response can address that specific disease. Right now, Ebola. Next, who knows?